Hi everyone, this is Kimmy at Mouth Muscle Memory, and I'm with my friend Dr. Afzali. Hi, Dr. A.
Hello, Kimi. How are you?
Hi, good. We have become friends on Instagram, and I love her mission. She is really big into doing non-extraction orthodontics, so making room for what you have and trying to avoid doing premolar extractions. And I'm a victim of premolar extractions. I had the best orthodontist in the state, took out 4 of my premolars. I have sleep apnea. It's a mess. So I'm really grateful that there's people in the world like Dr. A who can try to avoid that, because I tell all of my parents and their kids, like, don't let them take their premolars, don't do it. So we're going to break it down today, and she's going to teach us kind of like why it's better to have the premolars and kind of what it ends up looking like if we don't have them. So she came up with an awesome presentation. She's going to show us that. Why don't you give us just a little background on yourself, Dr. A, like where you're at and how you kind of got interested in non-surgical orthodontic?
Great. Kimi, thank you so much for having me. And I really enjoyed our conversations about different orthodontic procedures. I love your enthusiasm and your commitment to really great care as a
Thank you.
myofunctional therapist. And I always enjoy your posts. So uh, this is one of the greatest thing about social media communities, that you find like-minded professionals that can really make a difference, and that's what really is all about. As earlier I was telling you that I spend my whole day today putting this presentation together, and I went over it and over it and over it, and I cut the technical language down and then read it again, and I said, oh, I have to make it simpler, simpler, simpler. Why do I do that? Because I don't want to turn away my audience and your audience with concepts that they don't understand. If from this um, exchange of ideas that we have, we can even help a dozen people to avoid non unnecessarily extractions in orthodontics, I think we have done well. And then that would be a repelling effect that hopefully it just continues to expand as it is, as a movement that is happening. So you are right, is my passion, and I think when you are having this passion, then every case that I see, rather than being fixated on obstacles and problems and uh, what I cannot do, I turn on the motivation and the creativity and solution finding. Uh, you know, uh, Strategies that I can use to help my patients. So I have put something together, as you mentioned. I will go over it with you guys, but I like to give it back to you if you want to add on anything before I start.
Yeah, tell us a little bit about how you kind of got interested in avoiding jaw surgery for certain orthodontic problems, because underbite, like certain types of crossbite, really bad overbite. A lot of times, if there's really complicated ones, the orthodontist or the dentist don't want to touch them and they say, well, you have to have jaw surgery. Well, people can come to you in the LA area, and your specialty is kind of like, how do I get this to work and try to avoid surgery? So why don't you tell us a little bit about your son and how you kind of helped him?
Sure, sure. Yes. My son started his first orthodontic treatment when he was 11 years old. At that time, I wasn't doing orthodontics. I was focusing on TMJ and full mouth reconstructions. And of course, he went through that. And then it was right into his late teens that he needed the second orthodontic treatment. And he got that. And then once he was 21, I believe, then, we saw that there is need for more. So I wanted to give him the options. I went to every single doctor appointment with him that he asked me to go with him, and he chose a, a doctor to work with. And I was in close communication with the doctor and try to do as much help as I can. And then I can, we go over his case after, I think, close to 3 years, 2.5 years. I show you what his jaw looked like, and he was really disappointed. A lot of finances was invested, and also he was really having TMJ pain. He was uncomfortable. And one day he told me, it's not fair. These are my best years in life. I shouldn't look like this. And, that really uh, made me, it just, I felt different. That sentence really drive it home for me. And although I was, respective to his opinion and his choices and the recommendations that he had got from, his chiropractor and all of that, I felt like, sometimes you need to put your foot down and you really need to um, get the job done. And that's exactly what I did. One day when he was in one of our offices in Orange County, the Lake Forest office, I told him, please let me help you. The worst that come to, the worst that's going to happen is going to be the same as it is. Just let me help you. And then my office manager pulled me back and she told me, don't force him. Don't let him do whatever he wants. I said, no, this is gone too far and we need to do something about it, because I was seeing all the emotional aspect, all the really emotional issues that this had created for him. Plus, he was wearing these removable retainers. His teeth were getting cavities underneath, despite his meticulous hygiene and all of that. So it couldn't continue. And then that was it. I got him in the chair, got him um, started with the braces, and then I did all those techniques that I know in TMJ. Immediately he started feeling better with TMJ, and we started doing things that everyone had told him is impossible, getting the upper jaw in front of the lower jaw, and resolving the arch-wide crossbite, which
Because
is
he was like
basically,
a typical surgery case, like usually be
yes,
orthodontic jaw surgery. So that's
yes,
a big deal.
yes, absolutely. It was a Lafort case, and I went with him to oral surgeons, and it was definitely a Lafort case to build his upper face, mid face also. So that was really the point that from family standpoint. But prior to that, there is another lady that I will share with you her case. This lady was really desperate. She had gone to a lot of doctors, and everyone had told her, you really don't have any option but surgery. Surgery is your only option. She could hardly hear, and she was also uh, uh, you know, um, having TMJ pain. She was really having difficulties. And she told me, I want you to help me. And of course, I spent time with her. I did the whole ortho records, all the analysis and everything. And I told her, I will try to do my best. I really want to help you, but I cannot really promise. But uh, I can do my best
Mhm,
to help you as long as you understand this is not something that is an ordinary thing. And she was perfectly fine with it.
mhm.
And we can look at her case. We're going to remove her braces soon. I kept her on braces for longer period of time because I want to save her some money, closed up the spaces that she needed for implant, try to manage that, try to do several things for her
Mhm.
to avoid additional dental procedures. Yeah.
Actually, speaking of her, she just came in, so I'm gonna let her in.
Oh, great. Actually, the one that we are admitting is another story,
Oh,
but we, we have many of them. But yeah, sure, Kayla.
all right, we'll let Kayla in.
Hello.
Hi, Kayla.
Hi, Kayla.
Hi.
Hi. We're
How are
recording,
you?
so we're just kind of jumping right in.
All right, no worries.
Yeah, Kayla, Kimi is a friend of mine. She is a myofunctional therapist, and she helps a lot of patients to avoid surgeries as well. So
Cool.
thank you so much for joining us.
Yeah, of course.
Yes.
So, what's your story, Kayla? Like, how many times did you have braces? Were you told that you had to have jaw surgery?
Yeah, so I had braces for 9 years when I was younger, and then about 1.5 years with Dr. Afzali. So yeah, I had a very extensive, I guess, case. I had an underbite and then very crooked teeth when I was younger and a lot of crowding. And so they put braces on me when I was 6, and every time I lose an adult tooth, they would put, or every time I lose a baby tooth and another adult tooth would grow in, they would put another bracket on. And it was just, that was kind of my life in elementary school. And yeah, so I had those on for 9 years roughly, headgear, extractions, the whole 9 yards.
Oh, did they get your premolars?
Yeah, so I have 2 missing on the top and 2 on the bottom.
Mm.
Yeah, and when I was 14, they basically told me, this is as far as you're going to get with braces. I still had a slight underbite. My teeth were very straight, but and yeah, so they said, when you're 18, you're going to have to get surgery. This is the best that we can do. And so I just kind of had that in my mind. But then I turned 18, obviously didn't have the money or the means to go and get jaw surgery, nor did I want to pursue that option if there were alternate options out there. And
Absolutely.
yeah, so I found Dr. Afzali. I actually got referred to her through my dentist because they told me that my gum recession on a couple of my molars was really, really bad because of the way that my bite was sitting.
Mhm.
So
Interesting. And let's see your teeth now.
yeah.
I'll make an opinion.
Yeah.
Ooh, look how straight. And
Yeah,
those are teeth, they're not crowns?
nope, those are teeth, all mine. Yeah,
Wow.
yeah, they look great.
Let's see your top and bottom, how they line up. Oh, much better. Much better.
Mhm.
Are you in Invisaligns right now?
No, I have I have the top retainer that has the little expander. So I've done that a few
Cool.
4 times, but now I'm just maintaining, and then just the clear tray for the bottom, and just
Awesome.
wearing those pretty much 24/7 unless I'm eating or speaking. So
Awesome. And how is your jaw feeling now?
a lot better. I had a lot of jaw pain and clicking, especially in this side of my jaw, to the point it would pop all the time and it would hurt really bad. I don't have that anymore. I mean, occasionally pops here and there, but nothing abnormal and nothing painful like it was before, which is great. And then I've also just noticed changes in the way that I speak. Before, very evidently, I mean, I guess to me, I don't think people would have noticed it as much to me, but I could tell that I was speaking almost with like a lisp because of the way that the air was moving through my teeth. And so thankfully that is also resolved. So a lot of positive changes.
Very cool. Very cool. All right. Do you want to show her case on your website?
Sure, absolutely. Let's check. Let me.
Kayla, did your sleep change at all?
I don't know if I noticed any significant changes in my sleep, but I mean, like my breathing, I will say changed, which I'm sure affected my sleep. I mean, previously I would end up inadvertently doing a lot more mouth breathing just because my mouth wouldn't close all of the way because of the crossbite and underbite. And that is no longer an issue, which is great. So yeah, I've definitely been practicing like face yoga, mewing, doing whatever I can to maintain and even continue building like the upper palate.
So, Kayla, thank you so much for joining us, and sharing your experience. Earlier, I was explaining that really the purpose of this is to let young people, all people know that there are solutions, and there are ways to handle their problems in a gentle way and in a non-surgical way. So for you to come and share that, you're really helping future patients, that people that understand there are options.
Yeah.
And I just enjoy every day. I really appreciate the trust and faith that you put on me. And that was the ingredient that, really a very instrumental factor on making this possible. So, basically, as you remember, the first day that, we saw each other, we talked about the challenges that we had. And the biggest challenge was the 4 bicuspid being extracted. And when we look at it, what do we need in upper jaw? We needed teeth to expand, and that was missing. And the other challenge that we had was, of course, the TMJ situation, that when cases are symptomatic in terms of the TMJ and popping and clicking and discomfort, then I have to take much more careful approach in introducing the procedure to. So that was another challenge that we were dealing. But one thing that definitely wasn't a challenge was your willingness, your commitment, and really your cooperation. That was a huge plus point on the success of this case. As far as points that I like to mention is that, going from here to here, the active treatment time was about 14 months, because during COVID, we were not really, during the lockdown for COVID, we were not seeing Kayla. So if you look at the time period and for the type of transformation that we got, I believe it's something very inspiring for any young person, because when we talk about orthodontic treatment, usually it's a lengthy procedure. So one of the things that I want to encourage, people that are listening to us, is that don't be afraid. Don't sit at home and don't be bored with ideas that you don't want to be on braces for a long time and is going to be complicated or anything. Instead, find the right doctor, find a doctor that you can relate to, that you can come up with a mutual understanding and mutual agreement on your treatment plan and move forward. Because this type of situation, Kayla, of course, is young, and these type of symptoms, like with the TMJ and basically the misalignment and malocclusion, manifests itself, especially after age 30, at the totally different level. So I am very happy that we were able to help you, Kayla, with this, because this stable bite means a stability of the joint. And then we can see the neuromuscular function, the facial nerve is awakened, the muscles are awakened, and we can see that these changes that we see in the basically the lift of the face, like the
Yeah.
distance from the eyebrow and the upper eyelid, and the lift of the nasal,
It almost looks like you had plastic
nostrils.
surgery or something.
Yeah, it does. It's really crazy when I saw I mean, obviously I was very self-conscious of it, but I mean, when you have it your whole life, you learn, your angles and photos and things to accommodate, but seeing it like straight on comparatively, I was very shocked and pleased as well. But yeah, it's crazy.
That's great. Thanks so much for coming on and like sharing your experience. Like, we really appreciate you.
Yeah,
Yes.
of course.
Thank you so much, Kayla.
Of course. Take care.
Bye-bye.
All right. Bye.
Okay. Good.
So
That
if
will
you
be
like, yeah, I can share quickly my son's case while we are on the subject. This is my son's case. This is what he looked like after basically 3 cycles of orthodontics. And
He
this
had
is
3 rounds of braces, and that's all they got him to.
Yeah, and then this is the last round was not braces, it was removable appliances. And this is what we could accomplish. Again, his active treatment would be less than 11 months, because for about 2 months he was out of the state and I wasn't able to do any adjustments for him. So yes.
Wow, that's incredible though, because this would be like an underbite, crossbite. His lower jaw's like more forward.
Yes.
I would
Absolutely.
guess probably some lateral thrusting of the tongue.
Yes.
Wow.
Absolutely.
So that would be like a classic surgery case, and a lot of times. And he was told that before.
Oh, sure. Multiple times. That was the recommendation.
And how is he feeling now?
He loves it. He's, I really can see that there has been a lot of positive things happening in his life. I never talked to him about that because, that's not my place to be evaluating this, or, but I believe that the fact that his attention is not on this, and he is not self-conscious about it, that by itself is something that really has freed up his mind, and he's moving forward with his life.
That's great. All right. Well, now Dr. A is going to teach us about reasons why we should hold on to our premolars and try to avoid doing premolar extractions, especially with kids. My theory on that, being a premolar extraction person, if the house is too small, you gotta build a bigger house, which is the roof of your mouth. The whole reason why any of this matters is the airway. We have to have a nice sized house because that's where our tongue comes in and parks in that house. So the smaller your mouth is, the smaller your palate is, the more crammed that tongue is. And if the tongue can't live in the mouth, it's going to live in the airway. So Dr. A, why don't you show us your presentation?
Yes, I like your analogy of making the mouth an analogy to a house. This is absolutely the right way of looking at it. And we definitely, there are three ways that we handle the crowdness. You know, one is by removal of the teeth and, you know, basically making less teeth in the mouth. Another way is by slimming them by interproximal reduction. And another way is by expanding the jaw.
Mhm.
And so why not use every opportunity that we have to expand the jaw rather than going and removing tooth structure or removing teeth?
Mhm.
Of course, is this 100% of time possible? No, there are cases that, you know, unfortunately, surgery is absolutely the only option. But I believe there are a lot of opportunities for non-surgical approaches for cases
Mhm.
that the surgery is being suggested.
Yes.
So when I'm talking about surgery, we can, you know, this particular aspect of our discussion, I want to focus on premolars, basically, and
Beautiful.
just talk. Yeah. So you have your own personal experience, and we just had our, you know, Kayla joining us, and she shared her experience with the premolar extractions. And uh, these by themselves give me enough reason, you know, hearing stories like yours that makes me not a fan of this
Yeah.
concept.
Yeah.
And of course, there is much more into it, but this is how I see it. One of the first things that happens when we get the premolar extracted, then we get instability of the position of the teeth and the relapses of orthodontics. It increases. A good percentage of my patients already had orthodontics, and this is their second time that they are having braces. So that is one of the issues. And again, this case is a vivid example of it, that at the young age, the premolars, 4 premolars were extracted, and then this is what happened, the total relapse. The relapse can manifest itself in different ways. One way, it could be the relapse of the arches altogether, which would cause the relapse of the position of the upper jaw to lower jaw. And that's exactly the great example of that. Some other relapses can be the teeth themselves. So that's one example.
Or open bite, where the tongue, when it swallows, it pushes forward into the teeth. That will create the bite to open, so the teeth are open in the front.
Absolutely. Reduction of the size of the arch, because when we are pulling teeth, we are reducing the size of the arch. So what happens is that tongue, as you mentioned, would want to come out because we are reducing the free space inside the mouth. And then that itself is another instability that you see. Yeah. And this patient came to me after 2 years of being on braces. You know, when she came, she was on braces for 2 years. And 4 bicuspids, 2 from the top, 2 from the bottom, were extracted. And that's exactly what she looked like. A young girl, 16 years old, and these black triangles, you see the constriction of the jaw. You know, you can see the tension in this picture. This is what she looked like on the right side. And one of the other issues that we have with the premolar extractions are, as we constrict the arches, then we we have a tendency to get spaces between teeth. And this case has been very resistant to closing the spaces. It has happened a couple of times that after I removed the power chain, she came the next appointment, I see there is a space between her teeth. So I have to go through different systems and, strategies to get this stabilized. So that is definitely another problem that we see. Another thing that I want to point out to, you see the collapse of the jaw where the premolar was extracted. This is very noticeable. And basically what is happening is the arch is shrinking. Arch has shrunken and now it's, we see this fissure here. This is the front view of the same patient. I just put this picture in here so you can see again the loss of the structure. We have the front area, and then when we go to the back area, both sides are sitting back. It's constricted, it's curved in. This is the X-ray of the same patient. I honestly don't know what was the logic and reason beyond these premolar extractions. All I can think of was that this impacted canine could be a consideration that, to bring this into the mouth, we have to remove the premolar. And then since we remove this premolar, let's remove the other three. Again, I don't know what was the situation, and really patient didn't know much to fill me in.
Yeah.
All I saw, this was the first day that I saw her. And one of the things, as I did a lot of full mouth reconstructions, for patients with TMJ. And when you do that type of dentistry, you really understand and learn very early on that you have to work on directing the forces of the bite or occlusion along the vertical long axis of the tooth. That means a straight like this, not like that. That acts as a, I don't want to get too technical, but let me explain it to you this way. If you have a post that is in the ground, you go and apply forces.
Like a hammer or something.
Hammer it down from the top. As long as that post is in a vertical position, it goes into the ground and dirt and becomes stronger. But if that post is in a diagonal position, has any degree of angulation, and you apply the pressure on the top of it, it acts as an extraction force. You see, you put the force here, you get shear force. And this is what we see in malocclusion and misaligned. People start losing gum. People start getting
receding
gums, enamel chips off, which we call abfraction, when the enamel rods pop out. So that's exactly the manifestation of that. And what really concerned me about this case is that these teeth are now to a degree subject to shear pressure, because when she bites, is not going along the long axis of the tooth. So that's a very, really key factor in treatment planning. And when, treatment planning for bicuspid extraction, keeping all these facts in mind. So that's another major factor that I'm not a fan of bicuspid extractions at all, because of
Well, and to be fair, like
what we are looking at here.
I have a lot of
And
patients that are premolar extractions. I have them too. Like we're just more prone to clenching and grinding because you made your mouth a tiny house for your tongue. So the tongue generally likes to hang out more in the floor of your mouth or in the airway. So we're a little bit more prone to TMJ and to clenching and grinding, which I think you were going to talk about TMJ. So maybe we should go
Sure.
to the next area. Yeah.
Sure, absolutely. Actually, it's our next area. So let's go to the next subject that we want to talk about as it relates to extraction of the bicuspid and why we shouldn't, why it's not something that we should be promoting. Basically, jaw joints get strained and they are pushed back in the back position. And when the jaw joints is pushed back, then we will have compressing nerves and blood vessels of the joint. And this is exactly what I'm trying to explain. There is a relationship between the size of the arch and the position of the condyle. When we reduce the size of the arch, this cannot be, when we reduce the size of the upper arch and lower arch, we are putting more pressure on the condyle. And I show you the previous x-ray of this patient, which is a great example. You see how the head of the condyle is pushed back, and I don't see any space for the disc. You know, basically, it's just basically going bone to bone, pretty much so. And this is the same situation in here. So that's another reason. And there is no coincidence that, you know, when we talk about TMJ symptoms, then we go in and we find not every single patient that has TMJ has bicuspid extraction, but you find a good number of people that had bicuspid extractions do have some degree of TMJ.
Yeah, I think it's definitely like a risk factor. Like we're just a little bit more prone to it. And that
Sure.
makes a lot of sense about what you're saying with the joint. Instead of the joint being like this, it's kind of back in here.
Absolutely.
It has nowhere else to go.
Yes, absolutely. Yeah, your analogy is completely correct. And these I put these slides just to show that what happens on the teeth, where the teeth, how the teeth contact does matter with the position of the joint. You see when the teeth are all contacting, all the teeth are present, even the wisdom teeth, we can see the condyle in the right position is in articulating with its disc, which is this disc, and then with the temporalis bone, which is this bone. And then when we separate the teeth from each other, like a vertical change in the bite, you can see that it does affect the position of the joint. Just a simple touch, just to know that the position of the teeth do matter when we talk about the TMJ. That would take us to the next concept, which I know you're passionate about it and I'm passionate about it, because this is the area that these airway issues becomes the host of systemic issues that can be misdiagnosed and not diagnosed, not the root cause being addressed, and then the patient be the recipient of different modalities and different treatments unsuccessfully. So I would like to ask you, Kimi, to share your knowledge with us, as you're the expert in myofunctional therapy, and I'm sure you have a lot of tales to share with us.
Yeah, so the basics of the airway is human beings are meant to be nose breathers only, and the nose is a filter system. It's like, I call it like the HEPA filter. It's like goes in, gets all the allergens, it gets bacteria, it's antiviral, it cleans and humidifies, and then that clean air goes down into our lungs. If we breathe through our mouth, there are consequences. So breathing through our mouth, it's not clean air. It's really annoying to the tonsils or the adenoids, so they tend to grow, as well as on that picture there, right underneath where the nose is, there's that big red blob. If you kind of go over it with your cursor, the big blob there is the tongue. So right down, right there, right there. So that big blob is about this big, and that's your tongue. The tongue makes up the front wall of the airway. So with myofunctional therapy, we're teaching you how to breathe through your nose only and keep your tongue up in the roof of the mouth. Those are the big ones. When we have a smaller space or the palate is high and deep, we don't breathe through our nose as well, because it just doesn't have enough space for our nose. It's like everything is cramped up in there. And then our tongue is also cramped up in a small area when we have premolar extractions. So this is a great little visual that you have here, Dr. Afzali. How the airway affects us in other parts of our life and why it's related to other health conditions. If you don't breathe through your nose, your tongue's not up, then you're more risk for sleep disordered breathing, sleep apnea, airway resistance, where you just don't get good restorative deep sleep. And that's the big one.
Thank you. Absolutely. You know, all of the points that you mentioned is really key factors to consider. But the good news is that, you know, professionals like yourself are out there not only educating people about this, but also with exercises, with different trainings and showing patients that the change of habit can change the structure, and change of a structure can change the function. You know, you guys, I think, are doing a fantastic job.
Yeah, I'll take the tongues and you can take the occlusion part. I want nothing to do with that part. All right, let's see the
All right.
next slide here.
Yes, this basically goes hands in hand with what you were just mentioning. It's just a demonstration that the palate, you know, when we have this is the palate, and when we have the teeth removed, then the size of the palate decreases, and then the floor of the nose, of course, is decreased. And that picture is just for the same purpose. Okay. Then we go into this area of muscular and facial pains and headaches and shoulder and neck. I don't want to go too much into this because it could be few presentations itself. I just want to briefly touch upon it, that, as I mentioned, structures lead, correction of the structure will lead to possibility of the function in neuromuscular system. And once the neuromuscular system is awakened and is functioning, that's where we really see the changes. As we shared in previous part about our patients and the change of the face and all the great things that happen. And one thing that I experienced it over and over, even with the patients that I was doing full mouth reconstruction. After I'm a fan of making teeth younger looking and bringing youthful and healthy looking a smile. That's what a beautiful smile to me is, a smile that is youthful and it is healthy. And I was very fortunate that even with the crowns and veneers, I was able to create that effect for the patients before orthodontics. And one thing that I noticed by changing their vertical dimension, like opening up their bite, first of all, they would say, oh, I feel much better. My jaw feels better. And then I would see that their face is changing. Their eyes are brighter and they pop. And the lip would become uh,
More full.
more full and toner. It's the same thing that I see in my ortho patients now.
Yeah.
But the fact what is in function basically is when you restore the bite, a healthy bite, within a physiological range of motion for that particular patient. Each patient has a specific physiological range of motion. And that's what the beauty of these orthodontic work is, that really gives me the joy that each patient is treatment plan for what is designed for them.
Mhm.
And there is not a cookie cutter procedure that fits, one size fits all. We cannot have that approach the same way that in restorative dentistry I was dealing with. So once that structure is built properly, then this part comes just on its own. And the
Yeah.
facial nerve, which is one of the cranial nerve, it becomes active, like awaken. I would call it, the facial nerve becomes functional, then the muscles wake up and we see the results. And uh, release of headaches, tension in the face is just something that I don't even ask patients. They originate themselves that, oh, I no longer have headaches, or I no longer have tension in my face. So that's what basically the correct foundation does. So, Kimi, we talked about a lot of information. As I said at the beginning of this conversation, our purpose is to really make sure that our message is driven home and is driving home, and our audience are understanding what we talked so far. So I want to just summarize briefly why extraction of bicuspids should be looked at it carefully and very much examined before the final decision is made, to make sure that it is the best interest of patient. As I said, each case is different, and I don't want to send this message that if people that had wisdom bicuspid extraction, they necessarily feel like that it's the end of the world. No, I don't want to. I want to give the message of awareness, but also message of hope that there are solutions. And those solutions are in the hands of people like you, and like our patient that we saw, that even after bicuspid extractions, successful orthodontic work. So there is hope out there. But these are the reasons that we are. These are the reasons that we need to have a second thought about bicuspid extractions. Instability of the teeth and causing relapses, and relapses of the jaw as well. Black triangles at the corner of the mouth because of the shrinkage of the jaw size. Constriction of arches resulting in spaces between teeth. Continued airway breathing problems, as Kimi explained.
Mhm. And I would say too, like going back to what you said, it doesn't mean that you're like SOL out of luck if you had premolar extractions, but for my patients and for myself, I just have to be very particular. Like I have to make sure that my tongue is always in the correct position, or it will feel like I know that my airway is getting pinched off. So it doesn't mean that I'm out of luck. I just have to try a lot harder with my tongue posture and to help maintain my airway, because I do have sleep apnea, and that is unfortunately one of the side effects that I had from premolar extractions. That's why I'm so passionate about trying to educate parents or people that are considering it if they need adult orthodontics and they're suggested to have premolar extractions. I just want to put out that message that there's other options.
Yes, 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 definitely there is. So
I think that would be good for one
I believe
section.
that would end this as a part of discussion.
All right. Hi and welcome back. This is Kimmy at Mouth Muscle Memory, and I'm with Dr. Afzali, who is a fast braces provider in LA. And in our previous discussion, we were talking about all the reasons why maybe it's not the best thing to remove premolars for braces. So she's going to show us some of her cases where she was able to do non-extraction orthodontics and get some arch width to save these patients from having the ortho extractions and possible jaw surgery. So go ahead, Dr. A.
Hi, Kimmy. Thank you for continuing. Kimmy, can we do another one?
Yeah,
I was putting my hair up. I'm sorry.
that's okay.
Sorry.
All right,
I felt weird.
that's okay.
Okay. Yeah, and then let's say it because we are starting another one. So we should just say that in the previous episode we talked about that. Now we continue. Okay.
Okay.
Yeah. So
All right. Hi, this is Kimmy from Mouth Muscle Memory, and I've got Dr. Afzali from LA. She's a fast braces provider. And in our previous episode, we were talking about some of the reasons why it's not the best to do premolar extractions and kind of the consequences that come from that. So today, she's going to teach us about how she achieves her beautiful, beautiful cases that normally would be premolar extractions or jaw surgery. So why don't you show us what you've got, Dr. A?
Okay, great. Thank you, Kimmy, for the introduction. And this would be the continuation of, we did have the previous episode that we talked about the reasons that we shouldn't have we should have a second thought about premolar extraction. Now I share with you some slides so you can, we have the same reality on what I look at each patient when I see them. So basically, it's a change in the approach rather than when I see a case that crowded, looking at how I can remove teeth to create a space. I look at how I can expand to create a space. And I am trying to see, I have a little bit of a hiccup here in these slides moving. So let me, yes, okay. So in my belief, there should be a new understanding for patient and the dentist. And that understanding is that, the oral health, is holistic in nature, and it relates to our overall health. And it has tight connection with the skeletal structure and neuromuscular function. What do I mean by that? Means the way that our structure in the mouth is dictating our facial beauty and facial function and our overall health and beauty. And we really can make a huge improvement upon both health and beauty when we take on that view. This is a case that I want to just share with you as an example. You see that we have severe crowding of the teeth, front teeth. And you can look at this case and you say, okay, how am I going to create a space? We pull, you know, two bicuspid and then create a space. Of course, that is not what I looked at. And this is another picture of the same case. And then this is patient is mid-treatment, and this is from here,
Oof.
from, oh, I'm sorry, from here
Mhm.
going to here.
Wow.
And we haven't even finished. So
And they
what
can chew on their
happened?
back teeth now.
Exactly. Not only that, but you see that we have created a space. And this is the right view, and this is the right view right now. This is the palate, which is the house for the tongue, and you can see the arch form. And this arch form, by the way, is the foundation for the lips. So you want a fuller lip, you want a fuller nasolabial fold, you want a wider arch. I mean, this arch supports the lip. This one does not. If you see, this is not supporting as much, of course. And then this is the lower arch.
Woo-hoo.
So when you look at this lower arch, and then when you look at this, there is a lot of expansion. There is a lot of room that is being created. And the report of patient is just an incredible how she feels,
Mhm.
you know, how basically everything has changed for her in regard to the symptoms, previous symptoms and discomfort that she had. I just list few. She told me she can sleep better, she can breathe better, she can chew better.
Absolutely. I
And
was just thinking that mouth before where it's all V shape and your tongue is the manager of
and I
the,
believe exactly.
when the tongue is the manager of the mouth and you're working in a little tiny little corridor, it's hard to do things efficiently and effectively versus if you have more room to spread out, that tongue can have a lot more of a positive effect. It's a friend, not a foe.
Absolutely, absolutely, you said it right. And basically, I believe we are at this state that the message that I want to send to everyone is that there is a journey, and this is a process. And both of us, both parts, dentist, patient, myofunctional therapist, hygienist, the whole entire oral surgeons, you know, the entire dental team are really in a process of improvement. And that improvement really happens with active participation on both parts by patients, really willingness to understand the other side. And with honesty and respect, looking at the situation and see what is the, looking at the bigger picture rather than looking at just a straight teeth, looking at a functional mouth, at a functional smile. And through discipline and courage, I think the future is very bright on moving forward and really overcoming this issue. And by sharing and bringing awareness, you know, to as many people as we can.
Mhm.
And
Love it.
I believe it is responsibility of each patient that gain their own understanding and helping their healthcare providers to understand what their needs are. You know, after all, is your mouth, is your body, is your life. And you want to be definitely the one that be a participant in your oral health, which definitely impacts your
Yes.
overall.
I always say like you have to be your own advocate, and if it's not the right provider for you, or it's not the right fit, or that your gut's telling you something's not right, then maybe just get another opinion.
Sure, absolutely. So basically, that's the message. And I just want to end with this, that Kimi, if we lose that idea and focus of these upper teeth and lower teeth, lose that concept and replace the concept with a holistic view, I think we will do just great.
Yes. Don't just focus on the teeth. You got to think about the jaws, because the jaws will kind of determine your airway.
Yes.
Absolutely. Love
Yeah.
it. Thanks for your
Absolutely.
wisdom
Yeah.
and for sharing your cool cases. Like, I just think that's amazing. I've taken so many airway courses, and when I connected with you, I just could not believe what you can do with your fast braces. I've never seen anything like it. So I just wanted to share it because it's such a special, unique gift that you have. And if anybody is looking for someone in the LA area, Dr. Afzali.
Yeah, thank you so much, Kimi. I really appreciate the opportunity that, I had to share some of the thoughts and ideas that I had with you and your audience. And I do have 4 offices in Southern California. One of them is in downtown LA, another one is in Orange County, and 2 are in Inland Empire. So I also offer virtual consults. Our virtual line is very active on my Instagram, which is Dr.Afzali. You can always request a consult if you have questions, or if I can be of any help answering anything for you that would make a difference in your decision and in your approach to your oral health. Thank
All
you.
right. That'll be good. All right.